Next, Andrea Ruth. Andrea, welcome. She is Executive Director of the Missouri Health Advocacy Alliance. She's been an attorney for 20 years. She served as Governor Mel Carnahan's Policy Director in the mid-90s. And the Missouri Health Advocacy Alliance is a coalition of 40 consumer advocacy groups united on consumer voices for quality, affordable health care. Next, Sydney Watson. Sydney is a professor of law at the Center for Health Law Studies at St. Louis University, where she teaches health law and bioethics. Her research focuses on issues related to access to health care for those who are poor, and also for racial and ethnic disparities and other disenfranchised groups. Welcome, Sydney. And then Dr. Patricia Wolf. She is founder and executive director of the Meds and Foods for Kids, which is a nonprofit organization that seeks to cure child malnutrition in Haiti. She is a pediatrician in private practice in St. Louis and a professor of pediatrics at Washington University School of Medicine. Welcome, Dr. Wolf. Lastly, Daniel Landon. He is the Senior Vice President of Government Relations for the Missouri Hospital Association, a nonprofit membership association, represents every acute care hospital in the state, as well as most of the state and federal and state hospitals and rehab and psychiatric care facilities. Prior to working with MHA, Daniel worked in the Missouri House of Representatives for nearly 10 years. With that, these panelists are here to give us commentary and input as we go forward with this discussion. So again, thanks to all of you. Let's give them a hand. With that, we want to move into our part of the program where we can all hear from you. As we said, we want to hear your ideas, your comments, your questions as we go through this important debate. And with that, I'm going to take a seat with our panelists and look forward to hearing from you. So we have some people have submitted questions in writing. We'll take some of those, and we have, if we could collect, there's some additional cards here, and we will work on those. And again, thank you.
We're going to screen those.
And
Come out of a basket.
I'm going to start on the top here, but again, if we have some other individuals that want to do a question for the mic, we want to hear from you as well. But I'm going to start with one here to get us started, and then we'll go to you next. This is from Justine, and she says, yesterday my hairstylist told me her pastor informed her that proposed health care reform is no good because it takes away personal choice. She agrees with me. The change in our system must happen. What message can I carry to my community about how this health care reform will benefit individuals and families? Well, first of all, for those 45 or 50 million Americans who are falling through the cracks, they're going to have access to a health care plan. Also, as we mentioned earlier, people that like their health care plan keep it. But they have options. In the healthcare exchange, they'll have a choice from a variety of private plans, but also a public plan. And importantly, what this does to contain costs that are crippling our country, that are not only the biggest reason for personal bankruptcies in this country, a giant lug on business, hurts our competitiveness. And when you look at the statistics of the escalating cost trajectory we're on right now, by 2035, we would be spending about a third of our GDP on healthcare. We cannot afford the broken system we have. So I think there's important things in that. I think that's part of the message, and I think the other important aspects, it hits so many people. The reforms with regard to eliminating the discrimination for pre-existing condition and people changing jobs is so important to the mobile society we have, and frankly, to those small businesses that are out there creating most of the new jobs as we look for an economic recovery. So thank you, Justine, for that question. And let's, gentlemen, please.
My name is Ned Lips. I'm with UHY Advisors. One of the advantages that large companies have and why they have such a high level of health insurance is that they have a huge pool of individuals to mix together, and they have the ability to hire a professional negotiator to negotiate with the health insurance companies. That's a disadvantage for all regular people, union members, small business owners. Over the years, there have been contemplated ideas of allowing individuals, small companies, unions, even charities like Catholic Charities or whatever, to band together and create legitimate groups to negotiate health care, to hire a professional negotiator to negotiate with the insurance companies. Is that in this plan, and is it something that's being considered?
Thank you. Great question. It's, everybody knows intuitively when you have a bigger pool of people to spread coverage and cost, you can reduce the cost for everyone, and that's part of what this does by really having access to everyone in our country, but also having the market reforms so that when private companies or the public plan are part of that healthcare exchange, they're going to have to meet certain standards. So not discriminating for pre-existing condition, et cetera, so that there's sort of a basic standard of what has to be offered to be a part of that exchange. So it's going to help with that, the impact of having the larger pools, spreading the risk, and that's a really important basic element of driving healthcare costs down.
It can actually, maybe you'd be appropriate first.
And I wanted to ask our panel too to weigh in on this.
Yeah. One of the benefits of this exchange is that it would create a national pool, the biggest pool possible, and there will be economies of scale within that pool, which are better than any of us could get from being at St. Louis University or Boeing or a large employer. And it will be interesting to see whether that national pool will then bring down costs for the large employers who are the best negotiators right now. The other benefit of the national exchange is that the prices charged to us, the premiums, will no longer be based upon whether we have a pre-existing condition. We will be what's called community rated. We will all pay the same premiums with some variations based upon geography and age. In the House bill, that's a 1-to-2 ratio, and it's going to be very important for us to follow that in the debate to make sure that some people don't continue to be priced out of the market. And finally, as Congressman Carnahan has pointed out, in this exchange there will be credits so that those of us who make less than 400% of the federal poverty line, about $70,000 for a family, will be eligible for credits to help pay those premiums to make sure that there is affordable coverage for all families. So it's the ultimate pool. And I would say watch the House version of the bill, because in that version it is a national exchange. The Senate version of the bill right now provides that states would each set up an exchange, and states would even have the option of setting up a number of exchanges. Those will be smaller pools, likely to have higher administrative costs. I like the House version.
You touched on one really important thing. When you have the larger pools, we also have the ability to spread and shrink those administrative costs so that a larger portion of our healthcare dollar is actually going to treating the patient as opposed to administrative cost. Novel concept. But it's a very important part of creating those larger pools.